In Springer International Publishing entitled Evaluation of Eating Habits and Lifestyle in Patients with Obesity Before and After Bariatric Surgery, a Single Italian Center Experience. Authors compared the eating habits and physical activity of patients who had undergone the Roux-en-Y gastric bypass and sleeve gastrectomy. They conclude that eating habits improve, but the level of physical activity among postoperative patients does not increase adequately. The study occurred between 2013 and 2014. There were a total of 100 patients, and they were divided evenly into groups of men and women, as well as Roux-en-Y, gastric bypass patients, and sleeve gastrectomy patients. Patients were given a self-administered dietary questionnaire preoperatively and once again 6 months after surgery. The patient's height, weight, and BMI were recorded at both intervals. And here is Table 1 that shows that information. Table 1 shows where the baseline patient's characteristics and measurements are reported. The gastric bypass and sleeve groups did not differ significantly for their age, height, weight, and BMI. Patient self-administered questionnaires required participants to record their daily consumption of different types of foods in the food frequency section. In the food habit section, participants were asked about their food routines, such as the frequency of their breakfast consumption. The physical activity portion of the questionnaire asked participants to list the number of hours spent in weekly activities, watching TV, shopping, or exercising. Responses were rated on a scale from 0 to 3, with 3 being the healthiest. And then here is Table 2, which takes that information and splits it into three groups. All patients completed the questionnaires, and then each section of the questionnaire was scored, and these scores were placed into tertiles in order to describe eating behaviors and physical activity at baseline. The worst evaluation was assigned to the lowest tertile, and the best to the highest. Researchers concluded that the questionnaire scores improved more in subjects who underwent gastric bypass, even without reaching statistical significance. No statistically significant difference in physical activity score was detected through both gastric bypass and sleeve patients showed greater physical activity. The authors of this study do admit limitations associated with it. Some investigation becomes apparent that the experiment design and size is insufficient to uphold the burden of proof expected in the arena of patient care when realistically considering the assertions in regards to patient treatment. The participant population was limited to patients in a specific geographical area during the same time period and the same cultural backgrounds. A sample must be representative of the population, and a sample that's not is biased. Biased samples are not representative, and that information is not valid and can be inaccurate. It doesn't contain enough variety to be applicable to every patient population, as well as the population was quite small. Samples that are too small can be unreliable in their results. There were originally 100 participants, 2 dropped, so 98 completed. A larger sample size would have lessened the risk of a sampling error. Members of the medical community may be surprised to learn that the study only lasted 6 months, and patients were only seen 1 time post-operatively. More reliable findings could be obtained with a more longitudinal study. Participants that checked in at 6, 12, 24, and 60 months would give more information as to the long-term outcome as far as activity and weight management and consumption of food. Let's see. One of the most obvious flaws in the implementation of the study was the choice to use the self-administered surveys to collect data from the participants. They were asked to score their own food intake as well as their choices and their activity level and the strenuousness of those activities. Discrepancies in reporting could be intentional or could be due to patient error, but they do reflect or do bring up some questions about the validity of the conclusions of this study. Because of all of these reasons, the sample size, the and the questions of validity, we can't really take these results into consideration when to contribute to patient care, protocols, and surgical outcomes in a meaningful way.